Where's Brody?
Downstairs.
Downstairs. Okay.
What's he doing?
What's TV?
Watching TV.
I think he's not watching TV. I
Watching
think he's
TV.
watching kids.
Okay.
Birds.
Ladybugs.
No, it's ladybirds.
Ladybirds.
Yeah. What his name is this?
That's a gecko.
Oh yeah, it's gecko.
That's a gecko. Okay.
This is
Okay.
a tiger.
Tiger.
And this is a dog. And what is this?
It's a deer.
Oh, is it because
Brixton, how old are you?
Good job. We're almost 3. Dude, this is looking good. There you go. Absolutely. No concerns. I mean, I have to tell you, I think we've only been to our pediatrician when he was born.
Awesome.
So I'd go into the doctors and he had purple feet and they would just say, oh, he's cold. And I knew this just wasn't right because of how deep purple his feet were. And he was almost getting worse. And that's when I was talking to my friend who was also a patient of yours. And she was seeing you for something completely different, but she recommended you. So I reached out immediately.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hey everyone. Welcome back to the BioNexus Health Podcast, Autism Uprooted. Today we will be speaking to a mom from California, and we will understand the importance of early recognition of possible risk for autism. Brixton came to me at 5 months of age with numerous gut issues, skin issues, eczema, sleep issues. And his mom, Karen, is going to be with us today and has kindly agreed to speak about her experiences with the early concerns that the baby had and what prompted her, what alerted her that it might be uh, a big issue in the upcoming months for the baby, for little Brixton at 5 months of age. And I think that was pretty amazing, recognizing that that her child was at a high risk. So anyone recognizing a child, a baby pretty much, right? At that age, 5 months is an infant. So let's go ahead and welcome Karen to today's podcast. Oh, I think we have a visitor today, Karen.
Yes. Hi. Come
Who is this?
And Brixton. Hi.
Hi, Brixton.
You say hi?
Hi.
Show her your tooth. Show her your teeth. Go cheese. Show her your teeth. You say hi? Are you being shy?
Are you being shy, Brixton? Yeah?
Yeah.
Okay. So I just wanted you to, the floor is yours, Karen. If you would like to start, because the biggest takeaway for me was, I thought it was pretty amazing that you came to me when Brixton was just 5 months old. Could you let us know what was Brixton's journey? What made you seek help for him? How did you hear about me? What made you decide you want to do just Herbal?
So it started with, I think he was around 3 or 4 months. We started seeing like little rashes, dry skin. It was like that for about a month. And in that time, we had a dog in the home. He was on goat's milk. He wasn't on like basic milk. I wasn't producing any formula, like any breast milk. So he was just on goat's milk. Doctor originally said, well, maybe that's a reaction to goat's milk.
Okay.
Maybe he has some other underlying allergies. You know, I'd go into the doctors and he had purple feet and they would just say, oh, he's cold. And I knew this just wasn't right because of how deep purple his feet were. Um, and so things weren't just adding up. I still wanted to kind of trust what they were saying. We got blood work done. His allergy test came back, allergic to dog dander, eggs,
Oh, he
soy,
was
gluten.
allergic. Okay.
Yeah, to all of those things very severely. Egg, I think, in dog dander is an EpiPen. Um, and so then I think, okay, maybe it's all these allergies, but he's not having any of those things except the dog that we had in the home. So we removed the dog. They said it could take up to a few months for us to see some clearing and stuff because it takes a while to clear out dog dander, dog hair. We waited those 2 months and he was almost getting worse. And that's when I was talking to my friend who was also a patient of yours. And she was
Okay.
seeing you for something completely different, but she recommended you. So I reached out immediately. um, and so we got started on everything. Turns out, you know,
Okay.
his body was just rejecting everything. I mean, he would have mangoes and start itching. Everything was just, it was almost like he was turning allergic to everything. You know,
Yes.
I shared some videos of how bad and how photos of, I mean, it was just
Some
like
photos.
melting off
Yes,
his
you
skin.
did. Would you describe where the rash was? Like he had eczema, kind of dry skin, eczema type rash from head to toe.
Mm-hmm. It started like in the face, in the hands, then went to the stomach. And there's a few pictures I think I sent. There's a lot of redness, like
Yes.
as if he had like, it almost looks like the measles, like it's just red. His blood, you could see his blood just flowing almost. And then the purple feet, and it just slowly got worse. And that's what made me reach out to you looking for some other answers because they're telling me to go, you know, allergy medicine over the counter, just stuff that was just not gonna work.
How was his sleep and
Oh,
how was his digestion and bowel movements and things like that?
yeah, so sleep was pretty non-existent. We were up I think we got, you know, we had that owlet where it records their sleep. And I think every 20 to 24 minutes we were up because he was just miserable. We had to tie his arms down so he wouldn't itch his face. There's a picture I shared of we woke up in the morning and he got his arm out and just blood everywhere because he just
Scratch.
itched himself to blood. And so we didn't sleep. Bowel movements were very frequent, actually. He had a lot of bowel movements, like 6 a day. Um, and then just the itching, we couldn't even put him down. We had to carry him in a harness constantly. He just had to be attached to us or he would be itching. So we tried everything. I mean, topicals are just topicals. They're not going to prevent the itching. It's all
Right.
internal. So I was
Right.
probably screwing him up with all the Vaseline I was putting on him, thinking he was dry. But yeah, it
Right.
was definitely a learning experience.
Um,
Right.
at that time, how was he developmentally? You know, was he developing normally? Was there any eye contact? Was he meeting his milestones, or was he just too weak?
I think it's kind of hard to tell just because at 4 months we were just like so in wrapped up in his skin and all the
Yes.
allergies. I don't even think I was focusing on his milestones. There's nothing like super concerning, but I think if we were to keep waiting it out, I'm sure we would have seen all those declines because his teeth weren't growing in, his hair wasn't growing in. I mean, I can't even tell you if he was babbling or not. I mean, at 4 months, he smiled, but how much can you smile when poor baby is just constantly in pain, right? So I think we were just so involved in what was going on, I couldn't even record his milestones. But I'm lucky. I mean, we came to you before even 6 months. So
Yes.
before really milestones start hitting, um, and really, after 2 or 3 months is where we really saw the effect of what we were doing with his skin and his hair. And, then we saw a happy baby again, so.
Yes. You had mentioned that you were really concerned about, him being on the spectrum, and why was that?
Well, I do have an older son on the spectrum, and so my radar is definitely up. Um, One thing is just I don't know, the purple feet
Purple feet,
is
right?
really what really got me, because that's just not normal. And I was worried because all these things are happening. Of course, developmentally, I don't know what's happening to his brain. His skin showing damage, his hair, his teeth, all these damage outward. I don't know what was going to be, down the
Right.
road. So
And
I
no
all I
speak.
was focusing is on, let's figure out what's going on with him. So
Can you walk me through his development? Like, when did you start observing the skin, the sleep, the gut?
so I would say, I think we saw you in May. By July, we are already had started to see the skin clearing up, less bowel movements. The hair and the teeth, we didn't start noticing maybe 6 month mark. I'm like, oh my gosh, he's getting 4 or 5 teeth at once. Like, it wasn't just one, it was all of them. Like, something happened, a button went off. He had like little strands of hair, and then all of a sudden he started getting more hair slowly. Um, so it was just over time. I mean, the skin was the biggest thing. It was within like 2 to 3 months. I mean, it was really like, once I got it down, once he was on full protocol, like not slowly introducing. And yeah, I mean, it was just a huge, I think sleep too improved right away. At least he was going 2, 3 hours. So yeah, I mean, I don't know what his body was lacking, but it worked.
And can you talk a bit about, crawling, walking, speaking?
I mean, the difference I see is how advanced he is compared to a lot of other kids. And I haven't experienced that. I have two other boys, and one of mine is on the spectrum. And even my middle one, I mean, he is by far like so smart. He's in these class, like his little preschool class, and some of the stuff that comes out of his mouth, I'm like but it's really fun to see. I think back and I just can't believe what we went through. And now everyone's just like, how old is he 3? What?
How does he recover from cough, cold, seasonal issues?
Honestly, pretty well. He'll have a cold here and there, and I'm like, oh, he's getting sick. But then the next day he'll be like, fine, maybe a little bit of clear, runny nose, and then that's it. He hasn't really been down for the count at all, so he recovers pretty well.
Brixton, how old are you?
Uh,
Good job. You're almost 3. Dude, this finger right there. There you go.
You are 3. I thought you were 5. Oh my gosh. That's 5. You're 5. Okay.
you're fine.
You want to be 5, huh?
Brixton, where's Brody?
Where's Brody?
Where's Brody? Where'd he go? Where's Brody?
He's downstairs.
Downstairs. Okay.
What's he doing?
What's TV?
Watching TV.
I think he's not watching TV. I
Watching
think he's
TV.
watching kids.
Okay.
What about Brayden?
He's downstairs, honey.
Brayden too?
Is he watching TV or is he making a mess?
Is it a big book?
Huh?
I don't know.
Okay, go get your big book.
Oh, that was just so awesome. He's doing his ABCs, 1, 2, 3s, colors, shapes. Yeah.
Yeah. He knows that, all of it except all his ABCs. I mean, he picks in parts like maybe 5 or 6 of them, but for the most part, yeah.
Okay.
Yeah.
And you're okay with the Brixton being recorded, right? It's
Yes.
okay to have
Yeah.
right. Yeah, that's going to be so amazing for so many families watching.
Yeah, good.
Yes.
Yeah, I hope it helps people.
It's
I
a
mean,
lot of
shoot, if
hope.
you want them to reach out to me and they need help, whatever, want to talk, you're
Aw.
welcome to share my stuff. I don't care.
Karen, all these, he's almost 3, and we started with him at 5 months. So by the time he was a year old, he was doing really, really well.
Yeah.
But yeah, if you recall that, we ran several labs,
Mm-hmm.
right? And can you talk a little briefly about what you understood about the labs? What was his diagnosis? Um, what we found in his labs?
Yeah, I mean, I'm glad we did all the labs we did, or I would not have known how much mold was in his body and not even thinking there would be mold in his body, which resulted in, obviously, it came from me. Um, so finding that out, and that there's a form of Lyme disease that he has, and he's barely been born. So clearly I have Lyme disease, So there's a lot of things that I just never would have thought of. You think of Lyme disease, you think of, oh, you'll know it because you got bit by a tick. No, that's not the case. The mold, you think like, oh, you've ingested mold, your body will just clear it out. You don't think that all these symptoms that I'm having are resulted of mold. So, all these little things that came up, his, like you said, leaky gut, panda, all these things at 4 months old. If I didn't have those tests, I would not have known any of this. Would not have thought mold or Lyme disease, any of that.
All right, folks. Well, that was amazing little Brixton. He is so amazing, isn't he? It was really fantastic that he decided to come speak with us, right? It was such a treat. Anyways, so I hope that gives you a lot of hope and that gives you some answers. And keep in mind that earlier signs have to be noticed, and you have to go with your mom intuition. Don't let anybody kind of, sweep the symptoms under the rug. If you have strong intuition that there might be some future concerns that need to be prevented at a very early age. I have more and more moms that come to me at, when the baby is as an infant. So I've had so many moms come to me during pregnancy. They've come to me during lactation and breastfeeding. And we can do a customized herbal protocol at all of those stages. And then for a little child, as soon as problems start, it's best to educate yourself and give your child a wonderful, bright future. So I hope that was helpful and inspirational for many. And I will see you at the next episode of the BioNexus Health Podcast. Take care of yourselves. Bye. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.